Good morning, and thank you for joining us for Medicaid Modernization Part 1, What Does It Mean for Public Health? This is the first of a planned four-part series organized by the Iowa Public Health Association and the Iowa Counties Public Health Association in consultation with colleagues at the Network for Public Health Law. My name is Janine Moody, and I serve as the Executive Director of the Iowa Public Health Association. It's my privilege to moderate this morning's session. A few housekeeping tips before we begin. Due to the number of attendees on this webinar, all participant lines will be muted. To submit a question for our presenters, please use the questions feature in your GoToWebinar control panel. I will monitor all submitted questions and pose them to our presenters during the question and answer portion of the webinar. Today's webinar will be recorded and posted along with presenter slides. A few technical tips for optimizing your webinar experience. Number 1, utilize a USB headset. Number 2, use a wired connection versus wireless if possible. And number 3, close any applications on your computer which require large bandwidth. Let me briefly introduce our presenters. First, we will hear from Jennifer Steenblock, who is the Project Director for Healthcare Reform at the Iowa Department of Human Services. Next, we will hear from Marcus Johnson Miller, who's the Bureau Chief and Title V Maternal and Child Health Director of the Bureau of Family Health at the Iowa Department of Public Health. We will now turn the floor over to Ms. Steenblock.
Oh, let's see. I think, do I have to go back? Are you seeing my screen? No.
There should be coming in just a minute, Jennifer.
Okay.
There you
go.
Okay, thank you.
Are we on? Okay, very good. So thank you so much, and pleased to have the opportunity today to present on our newest endeavor with the Department of Human Services, our Medicaid Modernization Initiative. So as many of you are quite well aware, in February of this year, the department issued a request for proposal that was named the Iowa High Quality Healthcare Initiative. This approach moves the Medicaid program towards a risk-based managed care for a variety, or the vast majority, of our Medicaid members. And it's scheduled to begin January 1st, 2016, and our team is hard at work implementing this large-scale transition. Some of you may be very familiar with the information that I'm going to describe in these first few slides, but just to help level set a bit, we're going to cover some basic information about the initiative. The project's goals include creating a single system of care that will deliver efficient, coordinated health care and promotes accountability in the health care coordination. Also, another goal is improving the quality of care and the health outcome for Medicaid members and integrating the care across the health delivery system. There's an emphasis on member choice and increased access to care and increased program efficiencies, allowing for budget accountability. Also continued rebalancing the efforts to provide community-based services rather than institutional care where it is appropriate for the Medicaid members, and ensuring that we hold the MCOs accountable for a number of outcomes. The notice of intent to award was issued to 4 bidders listed on this slide, number 4, AmeriGroup, Iowa, AmeriHealth, Caritas, Iowa, United Healthcare Plan of the River Valley, and WellCare of Iowa. The target date to finalize the contracts is mid-September, so just in the next couple of weeks. We're working very diligently to get things finalized with these 4 contractors. The new managed care program has been named Iowa HealthLink. This branding links together the intention of the program, that is ensuring that the physical health, the behavioral health, and the long-term care are all under one program, coordinated together. We will be using the Iowa HealthLink logo and branding on all of our member-facing communications to help with the recognition of their health care coverage through this new program. This slide shows the 3 programs that are operated under the Iowa Medicaid Enterprise, which is a division of the Department of Human Services. So the Iowa Medicaid program, the Iowa Medicaid Enterprise, is recognized by CMS as a single state Medicaid agency. So as you can see, on the left is the Iowa HealthLink. That's Iowa's new managed care program. Also under the IME is our Hawkeye program. That branding continues, stays the same. You'll recognize it as Hawkeye. And then we'll have our fee-for-service coverage for the Medicaid members who are not part of Iowa HealthLink or the Hawkeye program. So I'll move into the internal operational readiness, how we're preparing to implement Medicaid modernization. We've identified key areas of focus or the specific these tracks that we are working through to ensure that we are ready to go January 1 of 2016. So first off, we've established a project management office to monitor and track our progress and ensure we're on track and on time. We also need to recalibrate our current IME operations, and that's resulting in a review and amendments of our current contracts. We have the rebranding of the program, or the branding, I should say, rather than rebranding, and with stakeholder, member, and provider communications. We have a very thoughtfully planned communication plan that we are rolling out. Things are hitting now in these last few weeks as we've been able to name the MCOs and we're moving forward.
Jennifer, this is Janine. I'm sorry to interrupt you. I have a few people saying they're not able to view your slides. So with your permission, I'm going to take back the screen and I'll advance your slides for you, if that's okay. All right, just so and just so everybody knows, the slides are uploaded. You should be able to see them in the handout section. However, they will also be posted to the IPHA website at the end, but I can understand why people would like to view them in real time with you. So if you can just tell me where I should...
We're on slide 8, please.
Okay. And thank you, Cammie and Amy, for speaking up. Okay, is that where we should be?
Yep.
Okay.
That's it, our key areas of focus. Sure. So we also are having close collaboration with our federal partners at the Centers for Medicare and Medicaid Services, who will be required to do the formal approval of Iowa's new managed care program. We're also aligning with our other agency initiatives very carefully and closely. We're working to onboard and prepare the MCOs, and we're have a number of readiness activities that we're planning for the go live of January 1, 2016. With slide 9 then, this slide outlines the work to be done by our project management office and describes the reviewing of our current IME vendors that support the Iowa Medicaid operation. Moving to slide 10. One of our areas of operations today is member services. That's our unit that supports the needs of our members, responding to questions, enrollment, assistance, coverage issues. And so like today's managed care programs, there will be an entity that is completely separate from the MCOs that will share member materials and help members with choices in a fair way. And so this entity is our current Iowa Medicaid Member Services Unit, which serves as the official enrollment broker. There are an enrollment broker today, and they will continue to do this work as we move forward, as we grow the managed care in Iowa. The unit that we contract with for our member services is Maximus. And the department has developed, again, as I mentioned, a robust member outreach plan to make sure that members throughout the state are aware of the changes. The MCOs will be required to manage the member's care and help with changes when a member moves from one MCO to another. The MCOs are required to have statewide coverage to allow members to move through the state without having to change their coverage. So the enrollment broker, again, to assure everyone, is an independent and a conflict-free of the managed care organizations. With slide 11, I'll take a few minutes then to talk about the impacts to providers as we transition to managed care. Slide 12 then, we've scheduled this year's annual provider trainings. We've scheduled those for the fall this year. In an effort to meet the anticipated demand for information, the trainings will be offered twice in each community that are scheduled, AM sessions and PM sessions. For Iowa Medicaid Modernization, the sessions provides a discussion of the upcoming high-quality healthcare initiative and the transition timeline. We'll also discuss ICD-10 implementation, which is effective October 1st, just next month. And so a variety of topics will be covered at this training, including background of the initiative and impacted member populations, member enrollment and transition processes, member, provider, and stakeholder communications, continuing to share in more detail what our communications plans and the various tactics will be. We will also talk about provider enrollment and the transitioning of healthcare, behavioral care, and long-term care services. At these trainings, we'll also have a transition timeline and be able to speak in greater detail and granularity about the transition. The link to the schedule and locations of the sessions are included on the slide. Janine, I just wanted to check in. Did I lose you with my slides? There we go. Okay. There is no cost to attend these sessions, and the link on the slides provides the schedule and location to the annual trainings that will be held, along with an online training registration form. You can also refer to our informational letter number 1539 that was issued August 20th, and that also has all of the details about these provider trainings. We are having these trainings, typically we've done them earlier in the summer, but we knew as we are moving towards this transition to managed care, by the early fall time we were going to have even more information to be able to share, and really things are happening very quickly and on a weekly basis, and so we thought the fall time was a better, more timely to be able to have these in-person provider trainings. Providers are encouraged to submit their Medicaid Modernization and ICD-10 questions ahead of those training sessions. Having those questions submitted will help us make the training as value and informative as possible for folks. Also, to keep up to date on the Iowa Medicaid news for providers, the link provided gives you the opportunity to stay up to date by signing up to be on our mailing list for information. With slide 13, as part of the transition to ensure continuity of care, the provider network and Medicaid rates will remain in place until June 30th, 2016. So the networks and reimbursement rates after June 30th will be negotiated by the MCOs and the providers as they establish their networks. So it's a 6-month transition for that physical and behavioral health care services, and then it's a 2-year transition of those provider networks for the waiver and long-term care. Slide 14 shows you this fall's provider training schedule, the location and the training dates that have been set. A little more detail for you. With slide 15, important points to note regarding provider enrollment. Providers should enroll with Medicaid before they enroll with the MCOs if they aren't already providing the Medicaid reimbursed services, and that Iowa Medicaid enrollment and processes remain the same. Medicaid will conduct more licensure and verification and database checks per requirements of the ACA as we're implementing the ACA regulations. There is also informational letter number 1539 that was issued, and that announces the winning bidders, the names of the 4 MCOs, and in that informational letter provides contact information for each of those MCOs. Providers can contact the MCOs directly with questions about contracting and how that will work. So we encourage providers to do that and reach out to the MCOs. Slide 16. This describes the renewal with Iowa Medicaid and the required IME renewal processes, which again are outside of the managed care transition, but we are required to do re-enrollment. There will be an informational letter issued with more information and details. So with slide 17 then, we move to our external operational readiness, so preparing to implement the Medicaid modernization. With slide 18, each MCO must be thoroughly assessed to ensure they are ready to serve Iowa Medicaid members. The department must ensure that the MCOs are able to process and pay providers, that they're able to enroll members, that they have the capacity of providers to serve members, and that there are processes in place to authorize the services. Our state staff will be supported by consultants that we've selected through a competitive procurement process to assess each MCO's readiness to go live 1/1/16. Slide 19 then describes the MCO readiness specific to long-term care. That CMS has issued guidance regarding readiness for long-term care members and readiness for the MCOs who will be serving long-term care members. Each state must have a plan to assess the readiness of the entities, the providers, and their contractors, and the MCOs to show that they are ready to effectively implement the long-term care programs. The states must require that the MCO have comprehensive long-term services and supports training, that they have experience and expertise incorporated into their operations and management regarding long-term care, and it's also applicable to any subcontractors that the MCOs might employ to deliver the services under those long-term care contracts. Slide 20 describes the structure of a readiness review for the MCOs, and typically a readiness review consists of a desk review of documentation requested from each MCO that would be followed by an on-site visit to each MCO, and then also follow-up reviews as necessary, including additional on-site if needed, to ensure that the areas identified in the initial reviews were resolved and progress had been made towards meeting the state's expectations for the readiness. Slide 21 describes the key deliverables for the review. So with the desk reviews, there's specific contractual requirements such as their policies and procedures, training materials, handbooks, educational materials, notices, incentive programs that they plan to implement, provider agreement templates, provider manuals, other kinds of documentation. Other documents that would demonstrate the readiness to implement, such as and manage an MCO project implementation plan. We would look at staffing plans, geo-access maps, their financial statements, self-assessments from their network providers, and other kinds of documentation. There are critical processes and operating functions that we would look at during the on-site review. So we would look at their validating how they would do their service authorization, their training, and the care coordination activities. Also with the IT systems and testing, so we would do a desk review that would include the various reports from the MCOs that we would request, but then there will be also an on-site demonstration of their critical systems. So looking at critical MCO systems, their interfaces for eligibility, enrollment, and encounter data, and their claims processing. There's other verification and validation activities that the state would do, including the service authorization, the notices that they will issue to providers, the provider credentialing processes, and their provider access standards. Slide 22 shows the timeline for the readiness review vendor, and we're onboarding with them and set to begin either late this week or very early next week. So this just shows you our timeline for bringing our vendor on board for that. Then I'll spend just a couple of minutes talking about communications, outreach, and education. So slide 24, we can move ahead. There are a number of tactics that are planned in order to educate members, providers, and a variety of stakeholders on this transition to managed care. So more information will be coming in the next days and weeks, but these are examples of the kinds of events and trainings or informational sessions that we're planning to be rolling out very, very soon. Slide 25, the first communication that we will be having with members is described as an introductory letter. And so this is the very first time we've done specific outreach now to Medicaid members. We've done a lot of outreach and education so far to providers and stakeholders and other others that are interested in the transition to managed care, but we're just now beginning the opportunities to reach out directly to members to help them understand directly what this new managed care program means to them. So the letter will contain information about the new program, the impact to members, and a timeline for the transition. And included in this introductory letter will be some frequently asked questions that will provide some additional details that will be important for members to understand. Slide 26 shows that we've developed tailored messages to these very specific groups. So we'll have different versions of this introductory letter that will go to the Medicaid members. This lists the 4 categories, if you will, of those letters. So first will be our long-term care and HCBS waiver members. They have a letter tailored to them because the kinds of information that they would need to know could be slightly different than some of these other categories. The second group of mailings is our current managed care members, so those that are part of the MediPass program, the Iowa Health and Wellness Plan, Magellan, the current managed care Meridian. Then our third grouping is what we've described as the traditional Medicaid members, so essentially those in the other eligibility groups, not part of item 1 and item 2. And then the fourth grouping will be our Hawkeye members. They will have an introductory letter tailored to them. So our timelines for this, the mailing is outlined on the next slide, that the introductory letters will be staggered. So within this first week, we are looking to send the long-term care version to members. We're going to start with that population. Then the week of September the 8th is when the Hawkeye version will begin mailing. Then the week of the 8th and the 14th, all the other Medicaid groups versions will go. And then finally, the weeks of the September 21st and September 28th is when the mailings will go for our current managed care members. So I think it's important to share that we're also developing, one of the tactics that was on an earlier slide is the stakeholder toolkit and a provider toolkit. And in that includes information that we will provide to you all as providers and stakeholders and interested parties for Medicaid managed care, so that you can take that information and help share with your groups and organizations that you all work with to help spread the word and get the word to the Medicaid members to help them understand. So included in these toolkits will be samples of these member letters, samples of the FAQs, just some suggested formats and emails that you might want to use to share with your organization. And those toolkits we're hoping to have posted by the end of this week, if not very early next week, so that you all can start receiving that information and share it. So with my final slide, I do want to share that we recognize that all are interested and very hungry for information about the transition. And now that the MCOs have been selected, we'll be able to begin providing these more details in the coming days and weeks. And so please watch our website and look for communications, the toolkits, the trainings, the in-person opportunities that we'll have to, again, provide the more details that you all are looking at. But again, we're still in this time frame where we don't have the signed contracts with our MCOs. So in the next couple of weeks will be critical times. After that, we'll have more granular information to be able to share with folks. So this final slide just shows you where the general information is around Medicaid modernization. So a link to our dedicated web page. We are in the process right now of receiving public comments for the federal waivers that we will submit. So there's a dedicated email box, or you can mail in your comments to the attention of Rick Riley here at Iowa Medicaid Enterprise. We also recognize that members and providers have very specific questions about what this transition and what managed care means to them. So we do have the dedicated member services and provider services contact information on this slide. But we also have a number of stakeholders who don't necessarily fall in that member or provider category. So we have a dedicated email box with stakeholders. If you've got general questions about modernization and the initiative, you can go to Medicaid Modernization at dhs.state.ia.us. So with that, Janine, complete? I'm sorry, Janine, I'm not hearing if anyone is speaking.
Thank you, Jennifer.
There we go.
Okay. Thank you. Appreciate your presentation. I'm going to go ahead and just remind all of our attendees that we will hold questions till the end. One of the primary features of this webinar was that we wanted to allow ample time for some robust question and answers. So we'll hold off on questions for Jennifer. We'll turn the presentation over to Marcus now, and then please do go ahead. I see that there are some questions starting to roll in. Just go ahead and submit those as they come to you, and we will take them at the end. Thank you. Okay, Marcus.
Thanks, Janine. Are you going to pull up my slides, or do you want me to?
Let's go ahead and try letting you present, and I will rely on our attendees to quickly point out if they're not able to see your slides, and then we'll do what we did for Jennifer. Thank you.
Well, good morning, everyone. My name is Marcus Johnson Miller, and I'm the Bureau Chief for the Bureau of Family Health at the Iowa Department of Public Health. And I serve on the management team in the department that has been monitoring Medicaid modernization and developing tools and resources for both the MCOs as they have been applying and are selected, as well as stakeholders across the state. So I am going to just briefly go through a number of those tools that we have developed that will hopefully help public health find its place in the era of Medicaid modernization. The first resource that we do have is just a resource page for MCOs on the Iowa Department of Public Health website. You see the direct link in red at the top of the slide. On that website, there's a little bit of background information and how IDPH can partner with the MCOs, and then a list of resources, which include descriptions of programs that we anticipate being involved in Medicaid modernization, as well as maps or contact information for those IDPH contractors that may be part of the MCO networks. We'll continue to update this website as new tools or resources become available, but this one has been developed. You can either get to it from the direct link on the slide, or else there's also a hyperlink on the IDPH homepage if you go just to idph.state.ia.us. Another resource that we have done is utilizing the Department of Human Services provider website. We have gone through and pulled out all of the IDPH contractors that are current Medicaid providers and have listed them in an Excel file based on the provider type. So we have included screening centers, maternal health centers, family planning, behavioral health, independent lab, lead inspection agency, public health agency, home health, and rehabilitation agency. Those were the types of Medicaid provider types that we felt most IDPH contractors fall into. We've sorted them by IDPH contractor, and we're going to be listing this resource on the website that I just mentioned previously. As you're reviewing the tool on the resources page once it's posted, we just ask that you review it, and if we're missing any provider types or missing any contractors that, public health contractors that are out there, to let us know so that we can be sure to include those in that resource for the MCOs. We wanted to make this tool an easy tool for MCOs to use to see who public health contracts with that are also would be part of the MCO network. The next tool we also developed was a crosswalk between the MCO covered services as outlined in the managed care RFP and the public health programs that we have at the department. So what we did is in the first column of the tool, you'll see the covered service that was in the RFP. The second column includes the IDPH program that could provide that service. And the third column, again, just tying it back to that Medicaid provider type. So if a current Medicaid provider is providing that service, it's linking it back to that service that's required in the RFP, hoping that the MCOs will see that and utilize this resource as they're contracting for specific services as part of the RFP. So again, we ask that stakeholders and public health staff do review this crosswalk and make sure that we didn't miss any programs as we pulled the information together, so that we can have a comprehensive list of IDPH programs that could provide services for the Medicaid Managed Care Organization. And next steps, we will be listing these two tools on the IDPH resources page by Friday, so we're in the final stages of finalizing those. Ask that you review the information, and if there are programs missing from either list, to contact me via email. My email address is listed there on the slide, marcus.johnson-miller@idph.iowa.gov, and we'll be sure to get those included, again, so we have a comprehensive list. And then also just a reminder to keep staff at IDPH apprised of any information you're getting from MCOs with your programs or agencies, so that as questions arise from other agencies, we can connect agencies that maybe are having similar experiences, or we can provide you assistance if you're having issues with the MCOs. So again, I just wanted to take a brief minute to share the tools that we have developed at IDPH to assist with the MCO transition. So Janine, back to you.
Thank you, Marcus. Okay, I'm going to leave your mic on, Marcus, and Jennifer, I ask you to rejoin us here. And a reminder to all of our attendees that we will now open the floor for question and answers. But the way that we're doing that, because of the volume of people on our line today, is that we'd like you to use the question and answer chat, or the question feature in your GoToWebinar panel. So let me pull up. Marcus, may I have that back from you? Is that all right?
Yes, that's fine.
Okay, great. Okay, so let's start with our first question. Jennifer, can we just do a sound check and make sure that we can hear you?
Yes, I'm here.
Okay, great. Okay, first question is for you, Jennifer. I would be curious how they are handling the 3 requests. Pardon me, GoToWebinar wants to show my screen, but you don't all want to see these questions. So, Marcus, may I leave it on your screen? Is that okay?
Yeah, I think what's up there now is just that introductory screen that shows our pictures and the title of the webinar.
Okay. All right, well, just a moment.
Yes, ma'am. From my understanding, Janine, we won't see the question bar on your screen if you have that slide back up.
Okay. All right. Thank you. Okay, so first question for you, Jennifer. I would be curious how they are handling the 3 requests for reconsideration appeal process from the 3 MCOs that were not selected. Can you speak to that?
Sure. What I can describe is that in the RFP, it does describe the reconsideration process and the appeal process. And you can go to the RFP, and that process is laid out. We're in that first stage where reconsideration is requested, and there is no specific time frame for the director to respond to that reconsideration. So we are in that first phase, but we're continuing to plan for our implementation.
Next question, do you plan to host a training for local public health agencies so we can better educate our clients that are impacted by these changes, ideally before the letters are mailed to participants? We are already receiving questions about the new coverage and if they can continue seeing their regular provider, etc.
So I would say on the contact information, if you are interested in us putting together some specific trainings, to send that request into our, did I have that on my last slide? Let me look here. I think it was on the last slide. That if you want to get on our distribution list, or if you want to request us to do some presentations or coordinate some trainings, we're happy to do so. And you could send that request to imecommunications@dhs.state.ia.us.
Okay, thank you. And the next question, I think also for you, Jennifer, is will introductory mailings and materials also be made available in Spanish?
Being made available in Spanish. That is a very good question, and I will follow up on that. But I believe that those mailings should be available in Spanish on our website. They won't necessarily be mailed, but we will have Spanish versions. But I'm going to double check on that. That would be part of our toolkits or part of what we would have posted.
Okay, thank you.
Mm-hmm.
The next question, will the structure of the dental wellness plan change at all with this modernization?
The structure of the dental wellness plan will not change. Dental wellness will continue the way it is today. The dental benefit for the Hawkeye Dental will continue as it is today. And then those that are part of Medicaid fee-for-service for their dental, that continues as it does today as well.
Okay, great. Next, there's just a housekeeping. Yes, slides will be posted. They'll be posted to the IPHA website. However, if you look in your GoToWebinar panel, your control panel right now, there's a handout section, and they are loaded there presently as a PDF, so you can download them right now, or you can wait for an email later today, which will tell you where the recording will be archived and where the slide sets will be located. That was an easy one. I took that one. Okay. Back to you, Jennifer. Will each Medicaid member be required to enroll with one of the MCOs or all of the MCOs to maintain Medicaid coverage?
Okay, so if I understand the question, the providers, the MCO, the MCOs have been requested or required by the department to contract with every Medicaid provider that provides Medicaid coverage today, beginning January 1st. And we are requiring that as long as those providers want to contract with each MCO, that they will do so to help ensure continuity of care during that transition time. So the first 6 months for the physical health and the behavioral health, and then for that 2-year time frame. So although we're not requiring that of providers, we're hoping that most all currently enrolled Medicaid providers will do that to help us ensure continuity of care, so that contracting would be requested with all 4 of the MCOs.
And so then there's a similar question, but it's what happens when a member doesn't choose an MCO to work with?
Oh, what happens when a member doesn't choose? Okay.
Yeah.
So we will have an enrollment process. So the first letter that I described is that introductory letter. A second series of letters will go out beginning in the October timeframe, and those are called enrollment packets. And so the enrollment packet will identify the tentative assignment that the member has been assigned to MCO number 1, number 2, number 3, or number 4. And the member then will have a period of time to decide, do they want to keep that tentative assignment or do they want to change that? And this will all be laid out in our toolkits that you all will receive, but I'm talking a very, very high level. So the tentative assignment goes, they can make the choice to keep it or to change, and then that tentative assignment, whatever their decision was, or the default to the tentative assignment, is what will be in place for January 1st. And then the member would have 90 days after that that assignment is effective, 90 days into January into that period of when services begin, to make that change if they wanted to for any reason. They don't have to have good cause in that first 90 days. So there will be several opportunities for folks to change their MCO, but initially if they don't choose, they will be defaulted to an MCO. Janine, are you still there?
I'm sorry. So I think that then, my apologies. I think that then is similar to this question, how will IME determine who stays on straight Medicaid and who joins a managed care plan?
Mm-hmm. So it's all based on eligibility groups and based on if it's a group that is excluded from managed care. So groups that are excluded would include those that are participating in the PACE program, the Program for All-Inclusive Care for the Elderly, or those that are Alaskan Native American Indians, the AIAN population. Those folks have the choice between fee-for-service or PACE or managed care. Then there are different eligibility groups that are excluded from managed care, such as the medically needy group, the individuals that Medicaid pays their premiums for coverage. So typically, everyone else will be a part of managed care. What I will also share, as a new enrollee becomes Medicaid eligible, for their first 1 or possibly 2 months before they select their MCO and become enrolled, they will receive fee-for-services coverage for that first period of eligibility until the MCO selection takes effect.
Okay. Is Maximus responsible for assigning the MCO initial assignments?
So we have a process with the IME where we really it's an algorithm that we use for managed care enrollment today, and so it's a system-generated assignment, that would keep families together in the same MCO, but then spread it across, MCO number 1, the next one goes to MCO number 2, the next one goes to MCO number 3. So it's a system generated, not specifically done by our enrollment broker.
Okay, and the next question, will there be different billing practices for each MCO, or will they remain as they are currently?
Each MCO could potentially have different billing processes and practices, and I believe that each MCO should have laid that out in their proposal, and those proposals are available on the Bid Opportunities website. So you can look at those 4 proposals and how they're planning to do that, but I'm sure more information will come very, very soon as the MCOs are onboarding, and we'll start to communicate with providers and work with us so that we can share some of that information as well.
Okay, then another question here is, what are the metrics the MCOs use to decide if they continue contracting with the provider after the 6-month trial period? Will the metrics be the same for all MCOs?
Mm-hmm. I am not certain what the metrics are, or if the department has even specified that. Janine, that might be one that we could tag for a follow-up, but I would also say those are the kinds of questions that we can reach out to the MCOs about how they will be operationalizing things.
Okay, thank you. And how is Hawkeye included and impacted by Medicaid modernization?
So the eligibility for Hawkeye doesn't change. It's where their coverage will come from, and so it will be one of these 4 MCOs. So it will still be the Hawkeye benefit package, but it will be provided by one of these identified managed care organizations. Eligibility remains the same, and the coverage remains the same. It's who's providing and their provider networks.
Okay. Next, how will the client be able to change their tentative assignment?
Okay, so they can change their tentative assignment by several different ways. In the enrollment packet, there will be a form that they can fill out and send back in. They can call member services and do that on the phone with an enrollment broker, or they can do it in person with an enrollment broker. They can also do it, we'll have developed our IVR system when you call into member services, and if you want to do it through the IVR system, you can do that, make that selection or make that change. You wouldn't necessarily have to talk to someone unless you wanted to. So a more automated option if people choose that.
Okay. Next, what is the plan for reaching members to sign up for an MCO who cannot be reached via mail, knowing that a great deal of addresses in the DHS system are no longer valid?
Yeah. So we know that's going to be a big challenge for us, and so one is part of our communications with stakeholders who work with Medicaid members to help them understand, Medicaid members understand how critically important it is that they report current address information to us. That will be part of the toolkit, what's in there. So we'll look to our stakeholders and current providers to help us with that. And that's part of our call to action, too, so that you all will know when, and we'll work with other stakeholders to know when are we getting ready to drop enrollment packets, to make sure that the members that you all work with can follow up with members and say, did you receive this? Are you familiar with it? Have you made your selection? So I think key is going to be the call to action with our stakeholders and provider networks to help ensure that Medicaid members are educated and understanding, and if they're not receiving it, that they can call member services and do that over the phone or have additional information mailed out to them.
Okay, great. Next, how will clients applying for mental health waivers be processed? Through the MCO or through IME?
It will continue to be through the IME as it does today. So all of the eligibility will be determined by the department and through the Iowa Medicaid Enterprise.
Okay, and will there be handouts, educational materials for participants regarding the coverage provided through each MCO so that they can make the best decision as to whether to keep the assignment or change it? For example, will one MCO be better for children with special health care needs, another best for elderly populations, etc.?
So the enrollment packets will include a brochure from each of the 4 MCOs. There will also be information where we will have the information on our website about each of the MCOs, but there will be links that each MCO is required to have a member enrollment website where information about their plans and programs will be shared. So to help a person make that informed choice by looking to see how are each of the different MCOs describing what they will make available to Medicaid members.
Okay, and do you expect that different MCOs will offer different services to members? I think that's sort of a related question.
Yeah, so I think they're required to offer all the same Medicaid services that are available today. So there's those core services that they must offer. I think the MCOs will have that flexibility to do additional things and provide additional kinds of services outside, but the core services that they're required to provide are outlined in the RFP and are those services that Iowa Medicaid funds today.
Okay, and then a very specific question. Will this change impact eligibility for the current vaccines for children VFC program?
It should not change any services or vaccines or coverage that are available today. That will all continue.
Okay. Will clients on Hawkeye United stay on the United plan?
No, they will pick one of the, well, actually that's another good question, I think, Janine, for my follow-up. The United plan, it could be different, what they're proposing here in the RFP. I'm not exactly sure what the differences will be, but because it is United as Hawkeye today and United as the MCO tomorrow, I guess I'm not 100% sure.
Okay, we will flag that one then. Thank you. Will there be one central site to check client eligibility or coverage, or do we check with each individual MCO?
You can check the, am I using the right term, the REVS system today, where you can call in and confirm or verify, a provider can call in and verify a member's eligibility. It will also identify which MCO.
Okay. Do the MCH Title V contractors need to contract with each MCO for payment for FFS, fee-for-service?
Well, for fee-for-service payment, that would be a contracting, continuing to contract with Iowa Medicaid. Iowa Medicaid will continue to pay fee-for-service, but if the for those members that are not enrolled in managed care. But for members that are enrolled in managed care, those agencies should contract with the MCOs.
Okay. If you need to take a drink of water and catch your breath, go ahead. I'll read slowly here. Does the benefit package vary from one MCO to other MCOs?
No, the benefit package is to be the same services, the same, you know, all of the maximums or caps or anything that is identified by the department today in our policies and procedures will continue under the MCOs who are offering the coverage.
Okay. After the initial 90 days, will there be another time when they can change MCOs? Can a member change at any time, or will there be an open enrollment time specified?
Sure. So we're careful not to call it open enrollment because it's quite different than the marketplace, where there's an annual via the ACA. There's an annual open enrollment time that's usually in the late winter time, and similarly, there's open enrollment with Medicare, for Medicare and the Part D plan. With managed care under Medicaid, the individual can change in that first 90-day period for any reason. Then if there's good cause, they can change at any time as long as it meets that good cause criteria, the very same criteria that we have available today for good cause. And then on the individual's annual eligibility determination time, that's when they can make the choice to switch MCOs or to stay with the MCO that they have. So it's tied to their eligibility renewal time as opposed to an open enrollment set period of time.
Okay, thank you. Next, will IME continue to manage the waiver slots?
Yes, IME will continue to manage the waiver slots.
Okay. Will there be a comparison chart similar to charts that are currently available describing the performance of MCOs for different populations? For example, elderly, children with special health care needs, etc.
Yeah, we're in the process right now of identifying and developing a number of reporting tools and dashboards, if you will, that we can make publicly available. And I can't necessarily say how those exactly look, but those are in the planning stages and will absolutely be available.
Okay, good. How will dental coverage be provided for Medicaid members not currently in the dental wellness plan?
So the dental coverage for those not currently in dental wellness will continue as it is today, fee for service. So we will continue to have dental providers enrolled as our Medicaid providers, and those providers will be paid through the fee for service process.
Okay, and will clients receive a Medicaid card in addition to a card from their MCO?
I believe they will just receive the MCO card, but that's something to flag for me also, Janine, for a follow-up, because that's essentially their coverage is through the MCO.
Okay, I've got that one.
Although I guess let me think though, an individual, not this transition period of everybody who's on Medicaid today, but as a person, let's say they put in an application to us in February and they become determined eligible. Their first period of time, that first at least month, will be fee for service, so they would receive a Medicaid card for that period of time, and then once they chose and went through the enrollment process with an MCO, then they receive their MCO card.
Okay. So should I leave that one flagged, or do you feel like
go ahead and flag it. Go ahead and flag it so I can make sure I'm given a full answer.
Good. Okay. How will the MCOs be monitored and evaluated over time?
So there are a variety of monitoring and reporting tools that we are in the process of developing right now as well. So there's at various levels, and we're really kind of establishing here through the IME how we will do this ongoing monitoring. So that is all in the works, in process, and more details to come as we've been able to, confirm what our processes will be. We can share that then at that time.
Okay, and here's another question about the Vaccines for Children program. It says, will Hawkeye children now be eligible for the Vaccines for Children program?
I think the coverage for the Hawkeye members won't change from what it is today.
Okay. Will the concerns raised by the Hawkeye board in the Des Moines Register article today cause any concerns with Hawkeye enrollment in the MCOs?
I have to be honest, I've not seen the Des Moines Register today, so I'm not sure what the article or issue is. So I would suggest, Janine, if we could flag that one for our follow-up, a comment to follow up to that question.
Okay, will do. Next question, what is the plan for transportation services with the MCOs?
Mhm. So the MCO will be responsible for providing the transportation services or contracting with an entity to do transportation for them. So that's where the MCO will be coordinating all of the care, all of the health care, physical health, behavioral health, long-term care, transportation type needs. The only care that the MCOs won't be providing and coordinating is the dental.
Okay, thank you. And I just want to pause for a moment and ask everybody, if you have any questions, please be sure to submit them via the question feature on your GoToWebinar control panel. We will end promptly at 10 o'clock. Both of our presenters have other engagements right at 10, but our presenters have agreed to review any questions that weren't answered and the ones that Jennifer's already flagged here and provide follow-up. So go ahead and get those submitted. Okay, next question. Will all MCOs pay providers at the same rate?
So the MCOs, we're still identifying during this transition time, and we'll be providing some more information about what the rates will be during the 6-month or the 2-year transition period. But then the MCOs will be allowed to establish and determine what their rates will be after that transition. But there should be more information, more details, better explanation we will be publishing soon about reimbursement.
Okay, great. When the client needs to re-enroll for services each year, will there continue to be the 3-month delay we're currently seeing?
So that's an eligibility process. And so that's outside of managed care implementation, that's the department's annual renewal processes that I know there has been some delays as we've implemented ACA and as we've implemented a new integrated eligibility system. So I can't speak specifically to that, but the eligibility processes I can confirm are not changing. Eligibility will continue as it does today with our local income maintenance workers.
Okay. Do you have an anticipated date when the enrollment packets will be mailed?
I think I do. And again, those are going to be staged the enrollment packets are staged similarly to these introductory mailings. So the long-term care and HCBS packets will go first. I'm getting some background noise here outside my office. I don't have in front of me specifically the timeline, but Janine, if you flag that one, I can share that. And in these enrollment packets, I think, or not the enrollment packets, the toolkits will specify that information as well.
Okay, great. Will there still be entire counties that are fee-for-service?
No, there will not be entire counties. Each MCO is required to be statewide.
I am going to take one last question for Jennifer, then we need to wrap up here. But again, use these last couple of minutes to go ahead and submit those questions and we'll get them responded to. Last question for you, Jennifer, for today. Do you anticipate moving full implementation date beyond the 1st of January, particularly if your readiness reviews reveal issues that require additional time to remedy?
So our planning is that we will be ready to go. The readiness reviews should be completed by December 1st. That will be an indicator for us if the MCOs are, meeting that threshold of readiness. But our planning is that we will be ready to go beginning January 1 of 2016.
Okay, thank you very much. On behalf of the Iowa Public Health Association and the Iowa Counties Public Health Association, I'd like to thank you, Jennifer Steenblock of the Iowa Department of Human Services, and also you, Marcus Johnson-Miller of the Iowa Department of Public Health, for presenting this morning and for your commitment to responding to the many questions which Iowa Public Health and the safety net providers have around Medicaid managed care in Iowa. We truly appreciate your time. I would also like to cue our audience into additional webinars which we are planning for this series. In Webinar 2, we plan to arrange for presentations from attorneys with relevant experience that might identify key positions for public health providers and county attorneys to negotiate in provider contracts with managed care organizations. In the third webinar, we plan to present local partners' experience in engaging with the Iowa MCOs to date. Finally, we hope to host a webinar which will create a venue to bring local public health departments and managed care organizations together to increase awareness and opportunities for collaboration. Please stay tuned for announcements regarding these subsequent webinars. At the conclusion of today's webinar, you will be directed to a brief evaluation of the session, and we would really appreciate your feedback as it will help to inform our planning for the remaining webinars in this series. An audio recording and slides will be made available on the Iowa Public Health Association website later today. We truly appreciate your participation in this webinar and your interest in Iowa's Medicaid modernization and how public health and safety net providers can engage to support population health. Thank you and enjoy your day.